Hi, my name is Dr. Todd Austin from Austin Family Chiropractic in Verdon, Illinois, and you may also know me from ColdLaser.tv on YouTube. So today I would like to talk to you about the LumiCare laser and how I use the LumiCare laser for treating shoulder conditions. In my clinic, I particularly see a lot of people come in with shoulder conditions. When they say their shoulder hurts, the first thing I do is I examine the rotator cuff. So I'll go into that a little bit more in the hands-on portion of the video. And then a lot of times when we see rotator cuff, we also see the subacromial bursa involved as well. So I always check that out too. And then I'm just going to go through some different protocols that I use in the clinic based on what I'm finding on these different shoulder issues, and then how I treat them with the LumiCare Duo lasers. And I use it on a daily basis in the clinic on my patients for all kinds of issues, but definitely a lot of shoulder pain patients as well. Typically when someone comes into my clinic with shoulder pain, I'm going to check out the rotator cuff first. I'm doing a thorough rotator cuff exam, and I've already got X's where I typically work. I'm going to palpate the supraspinatus muscle. If there's tenderness there, I'll draw an X. I'm going to palpate the infraspinatus muscle. If there's tenderness there, I will draw an X. I'm going to follow the supraspinatus muscle and the infraspinatus muscle out to where the tendons are, where they insert on the humerus. I'm going to mark those as well if they had pain or tenderness in them. I'm also going to check the subscapularis, which is just underneath the scapula, and I'm going to put an X there too if I need to work with that. Okay, and then there's two things we check on the front, and those are the long head of the biceps tendon, which is actually part of the rotator cuff, and the subacromial bursa, which a lot of times if a person has had a rotator cuff issue for longer than a week, and it becomes subacute or chronic, they will tend to have an issue with the subacromial bursa as well. Sometimes we'll also find pain in the deltoid muscle, and if so, we'll work with that over here. So several ways to do this. So if a patient came in today and all these areas were marked, I'm going to go to muscle setting on my LumiCare Duo, and if they had all these areas going on, I'm going to also turn it to where we only have the top head on, bottom head is deactivated, and I would just do a general sweep of all these areas, or hang out on each area for 30 seconds to a minute. Supraspinatus muscle, infraspinatus muscle. You can technically get the tendons here. The aperture head covers both of them at the same time. For the subscapularis, right there. And then for those two structures on the front we talked about, the long head of the biceps tendon and the subacromial bursa, working on those up here. Okay. Now, a lot of times what I'll find is we have, not exactly 7 things like I marked, but a lot of times we'll have 4 or 5 things we find on the initial exam. And so I'll do this sweep like I just did here, lasering all of those. And then the patient will come in the next visit, and there's only 2 or 3 areas of involvement. And a lot of times we'll still have maybe the infraspinatus and the supraspinatus and infraspinatus tendons, but everything else is cleared out. So if that's the case, I'm going to be treating with 2 heads. So let's say if I had the example we just talked about, we had an infraspinatus muscle was still sore, and then we wanted to work on the supraspinatus and infraspinatus tendons, then I would just do my treatment like this. So a lot of times we'll find that it will change from visit to visit, so I always recheck all those areas. And we can put both heads together like this right next to each other. So if we had let's say 2 tender spots at that point, I could treat like this. Okay, so that's pretty much what we're looking at there. So those are the different settings that I primarily use when I am using the Lumicare Duo laser for treatment of shoulder issues. And like I said, at Austin Family Chiropractic, I do treat a lot of rotator cuff issues as well as a lot of subacromial bursa issues as well. So as you can see, the Lumicare Duo is a great tool to have in your toolkit when it comes to treating shoulder injuries in a chiropractic clinic. So thank you for watching. I hope you enjoy your Lumicare laser, and happy lasering.